All right. Hello, everyone. Thank you for joining tonight's Health and Human Service Committee meeting. Thank you for joining us again. You could be anywhere, but you choose to be tuning in with us. HPA-TV, just as a reminder, HPA-TV will be broadcasting tonight's Health and Human Service meeting live on Comcast TV channel 96 and Frontier TV channel 6032. It'll also be streamed live on hpatv.org and the HPA-TV Facebook page. It will then be made available for future viewing on the HPA-TV YouTube channel. So as a quick, with all our meetings, we want to do a quick introduction with the tiles as I see them according to me. So if you could please introduce yourself, starting with Councilwoman Rossetti, and just let the audience know if you're a voting member or not.
You're on mute, Marilyn.
Yep, I know. I was trying to unmute. Something was happening. Councilwoman Rossetti, good evening. I am a voting member.
Councilman Gale?
Yeah, good evening, everyone. John Gale, and I'm also a voting member.
Majority Leader?
Good evening, Majority Leader TJ Clark, and I am a voting member.
Councilwoman Surgeon? Okay. I believe Councilwoman Surgeon is on a quick break. She'll be back. Mr. Osborne?
Assistant Corporation Counsel DeMar Osborne.
Thank you. Councilwoman Surgeon?
Good evening, everyone.
All right. And
okay, I got it now.
You got it? Okay.
Yes, sir. Thank you. Good evening, everyone.
All right, great. Director Arroyo?
Good evening, Health and Human Services Director.
Thank you. And we also have Mr. Eli Mercado here, connection and community liaison. All right, so we'll go ahead. So on the agenda today, what we have is a resolution from Mayor Bronin with authorizing the city to accept a grant of $60,000 in funding for the City of Hartford Department of Health and Human Services Heart and Home Health Program from the North Central Area Agency on Aging, NCAAA. So Director Arroyo, the floor is yours.
Great. Councilman LeBron, if you don't mind, I'll talk about all three of these together, but I'll go into each of them separately. So if there's any questions, just
Sure.
Because they're all from the same funding source and they're also going to the same population.
Absolutely. So let me read them all. Why don't I read them all, and then you can go ahead into. All right, great.
Did we lose him?
Apparently, I don't know.
Looks like we lost Leonie too.
Oh, wow, yeah.
Huh.
North Central Area Agency on Aging.
Okay.
Just so you know, we couldn't hear you read those. You just guys came back.
Oh, I just came back? Okay.
Yeah, you
So
were
I'll
both off.
Okay, I'll read them again. So we have three resolutions tonight. The first one is the resolution authorizing the city to accept a grant of $60,000 in funding for the City of Hartford Department of Health and Human Services Heart and Home Health Program from the NCAAA, the North Central Area Agency on Aging. We also have a resolution authorizing the city to accept a grant of $31,500 in Title 3D funding for the City of Hartford Department of Health and Human Services Keep on Living from the North Central Area Agency on Aging. And then lastly, we have a grant of $65,000 in funding for the City of Hartford Department of Health and Human Services Dollar Ride Program from the NCAAA. So Director Arroyo, the floor is yours.
Thank you, Councilman LeBron. So as you noted, we have three grants that we have here for resolution in front of you today. Each of these grants are grants that are for our senior population. All of them are either funding existing services or funding new services that, or not new services, existing services that we provide as a result of this grant. Let's start with the first one. The Heart and Home Health Program is a program that we receive and that the city matches, I think $55,000 of a match on this, including some staffing help as well. And this program is a program where we work with seniors who need some assistance with activities of daily living on a short-term basis. So, and there is no income requirement. So we're often capturing seniors who may not qualify for some of these services if they don't have Medicaid or other things. So what we're working there is providing up to 60 days of services in the home. So that could be like cleaning, some light shopping, some cooking, again, services within the home so that the senior can convalesce and recover inside the home. So that's the first one. And again, we received $60,000, which is a small increase from last year, and the city matches it with $55,000 grant as well. We receive referrals from our senior centers as well as both hospitals for this program. We serve about, if I recall correctly, about 75 maybe folks a year that we're serving through this program. Okay. Any questions about this one before I move on to the second one?
Councilwoman Spears.
You said you serve approximately about 75 seniors. My question, and you said you get the referral from different senior centers?
Councilwoman Surgeon.
Right. So, 100, so it's about 115,000. What do you normally pay someone to help these seniors?
I can't recall specifically because we contract with Hartford Home Care at Home, Hartford Healthcare at Home. But these are not CNAs, they're home health aides. So the rate is definitely lower. I believe, if I recall, around $15 an hour, but I could be mistaken. And this is about once a week. It's not an everyday service. So that's why we're able to serve more seniors, because this is not a service that's provided every day.
Okay. All right.
Okay?
Thank you.
No problem. And the really great thing we think about this program is not means tested. So we're not applying a means test to this. Anyone who meets the qualifications and gives us a referral, we can provide services if there's capacity to do so. Okay, so the second program is the Keep on Living program that is also from NCAAA. That particular program, the majority of those services, I believe, are provided through the North End Senior Center. So this is a piece of funding that we work with through the North End Senior Center, and that provides funding for nursing services around blood pressure checks, paying for some nursing services in the North End Senior Center. And again, it's about keeping them active. So there's some activities that go along with that. But the entire piece is making sure that our seniors are healthy, have access to services, and if they need referrals, we have the program to be able to make referrals as needed. Again, it's a small pot of money. We do not match. We do not match the funding. Our match for this is really on staff that helps to manage the program. So the match is on staffing for this.
Yes, Councilwoman.
So, again, are we contracting out the home health aid agency to do this?
We work with the North End Senior Center with Blue Hill Civic or Building Hartford, VHCA, let me say, with VHCA, and they contract with a nurse directly through that. So we're not doing it. We contract with the North End, with VHCA, who then contracts with the nurse.
And so you don't know how often the nurse go there or anything?
I believe it's once a week when we were open, and I know that the nurse has, we're talking about flu shots, so we did an event recently, and so some services were provided sort of like in a drive-by fashion. We did the North End and the South End Senior Center this way. COVID testing was provided as well. So we're trying to be innovative in how we're providing these resources, considering the fact that our senior centers, in and of themselves, the facilities are closed. So we are looking forward to doing more events of this type, where we have seniors come in, maybe for a short period of time in small groups, or through a drive-by fashion. And the South End did the first one, and it was very successful. So we approached the North End, and we did last week, I think it was. We did, or maybe 2 weeks ago. My weeks are all blending into each other right now. But within the last 2 weeks, both senior centers had an event. And I believe they served upwards of 75 to 100 people at each site. So served quite a few seniors. They received meals, a take-home meal. They had access to COVID testing. We were able to provide information about other services. And so we're going to continue to be innovative in that way so that these services can continue to be provided to them.
Okay.
Councilman Gale.
Thank you, Mr. Chair. Director Arroyo, going back to the first item, if I may for a second, you talked about serving approximately 75 people per year. And I'm just wondering, did you have more demand than that, or were you pretty much right on target with things?
So it's my understanding we're pretty on target. You know, we try to make sure and be measured in terms of referrals. If at this point I've not had more people been referred than we can provide services for. And part of that is also there are many other programs that exist. So oftentimes we're working with individuals who might not have access to those other programs.
Thank you.
Any other questions? So I think, Director, you were on to the third agenda.
Yes. So the third one is the Dollar Ride program. As you're all aware, we provide extensive transportation services to seniors in the city. This provides transportation to our senior centers, to doctor's appointments, and to the grocery stores. So we're doing this across the city. The only service that has not continued is obviously transportation to the senior centers. But we continue to work and provide transportation to doctor's appointments, both in the city and outside of the city. There's a limit in terms of where we go outside of the city, but we do provide that transportation service to them, to our seniors. And then we are also providing right now, in lieu of not having the senior centers open, there are probably in total maybe 150 seniors or so that continue to request meals. So we're using Dial-A-Ride to help us distribute meals as well. So we're distributing meals for the North End and the South End senior centers, and we provide a bus to the Hispanic Senior Center to also deliver meals. And Parkville has decided on their own that they deliver meals on their own, but we're using that in that way. So this is the way we're providing meals to our seniors as well. So we do one time a week where we provide, I believe, meals for the entire 7-day period, at least one meal for 7 days. They're like frozen meals. They're created by CRT. We contracted with CRT to do this. They deliver the meals to us, and then we deliver the meals via the bus on the North End, the bus on the South End. And then we also did receive some requests for access to fresh fruits and vegetables during this time. And so we've partnered with Food Share. Actually, not Food Share, it's, I believe, the Joan Dauber Food Bank up the hill from us. So we go up there once a week, receive a shipment for those families that have requested that, and then deliver those as well. So we're doing those items at this point in time. So the only service that's not being provided is the transportation to the senior centers, but transportation to medical appointments and transportation to the grocery store continues. And on the grocery stores, we have predetermined stops that happen at our senior housing facilities. So once a week, different senior housing facilities are served with the bus. And then we also do for single family homes for seniors that are still residing and aging in place. We provide access where they can call and make an appointment to be taken to a grocery store as well. So again, as I mentioned, a service very valuable, not provided in other parts of our state. It's very expensive too. Just so to be clear, the total budget for this is $735,000. We are only able to raise a little less than $200,000 a year. The rest comes from the city. So that's 5 days a week, service for 6 hours a day that we're paying for.
I think
Councilwoman Surgeon?
you answered my question.
It is very pricey, and I think there were concerns in the past about potentially having to cut back, and we addressed some of that because initially there was we had 7 buses and we had to come down to 6 in order to make the budget work. We've not necessarily received any complaints at this point in terms of people not being able to be served. People continue to be served. We really looked at how full the buses were and things of that nature to make the determination to be able to go down to 6. But, it's obviously always a question where we can maintain this level of service if other funding is not available because, their rates go up and we have to cover it and the budget has remained the same. So if the budget continues to remain the same, we might need to make those decisions in the future. And even if we do, I will also say that there are other services that do provide. So it's not as if there would be no access for any senior to be able to continue to access these services. The Hartford, Greater Hartford Transit still also provides services for, again, a low fee, but those services are also available.
Can I just ask, what is the total? How many seniors are we serving total overall in the entire city?
Ooh, it varies by program. Can I get back to you on that? I will be happy to follow up via email because I have to look at our performance measures, and I'll look at our performance measures. I'll give you 2019 and versus 2020 just because of the pandemic things slowed down, but I'll give you where we were at 2019 for FY 2019.
I'm just curious how many seniors we actually service in the entire city.
I will say I would like to increase that number. I think it could be increased. And so we did talk previously with our senior centers of how do we open the senior centers doors a little wider for more individuals that might not be accessing. When we go to our senior centers, it's sort of they have a steady bunch, and it's hard if you're probably a newcomer coming into that. So we have to find ways, I think, to make it more inviting for everyone to be able to come in. And so we've tried a little bit with the senior events that we've done. We did that senior event in City Hall that was not just for the senior centers, but we advertised it more. And so we wanted to do a bigger event in Bushnell Park, but unfortunately the pandemic didn't allow us to be able to attract more seniors as well and inform them of the services that are available. So we definitely think there's opportunity to do more there.
Yes, Councilwoman Surgeon?
I'm sorry, I've been just talking without going through you, so I do apologize. Through the chair, again, thank you very much for inviting me to your committee meeting. Find this to be extremely valuable information as you go out there and you talk to so many people, in our community. One last question, and that is, have you looked at practices throughout the United States and compare to see how the city of Hartford is doing as far as delivering services to the seniors?
I will say that we haven't. I think one of the things to note is we are, there used to be a program manager over this unit, and that hasn't existed in a number of years. This was pre-me coming on, sort of when the initial, I think, round of layoffs happened, when the city's financial situation was up for discussion. We, like every other department in the city, had to make some changes. And so we've not had someone that can do that specifically. We are bringing on, are shifting some staff because we have an opening. And so we're going to work with her to see and do a deeper dive into some of this. She's a new been with the city, Denise Smith. I introduced her at our last meeting, or at a previous meeting with Council President Rosado. So she has a different skill set than our former person in that position. So we're going to work with her to do some of that, but we've not done an analysis. And again, really, we haven't had a stronger leader, I think, in there. We had a person that was really great at doing the services. And so now this person has a little bit of a different skill set that we want to tap into. She could do services, but she used to manage our teen pregnancy prevention program. So she has a different skill set that we can work with there as well. And also a Hartford resident. And our previous person was also Hartford. So we've been really lucky to have Hartford residents that know the community and are working with our seniors.
Thank you so much. Thank you, Mr. Chair.
No problem. Majority Leader?
Thank you, Mr. Chair. Through you, my friend, Director Arroyo, I want to know what is the likelihood of the city actually contracting with more than one carrier to provide food and deliver food services to CRT?
So previously what we did were that the senior center chefs were actually doing it. And that's where we started out. And then we had a situation started at the South End when COVID struck, where a member of the staff contracted COVID, and then we moved operations to the North End, and then the same thing happened in the North End, and so that's why we went to CRT. Many of the volunteers are also elderly or older. Let me say they're senior citizens, active seniors. And so we've hesitated of going back to that model because if someone were to get sick again, we'd have to sort of reshift. We are having some conversations about that currently, about the possibility of doing that. I think for our end, we just need to make sure that if one senior center goes down, the other senior center is willing to take on the work. So that way we don't have to scramble. We actually here in the department, I've had staff on buses doing this work for most of the pandemic. So if we can get to a point where people feel safe about being on a bus and feel, and we've started with them now, bringing them on with the bus, but it's more about now doing the cooking and doing that kind of work. If we can get to that point and people feel that that workload can be shared, then we would go back to that. But part of the reason we did CRT was in working with NCAAA. They were looking for multiple days of meals in one shop to limit exposure. And when the senior centers were doing it, they were doing it 3 days a week. So much more exposure for individuals versus us being able to do one day a week of meals with CRT.
Okay.
Councilman Gale? Oh, yeah, go ahead, Councilman Clark.
So with that, my only concern is, and I definitely understand the rationale behind that. I want to say the meals from CRT are prepackaged, correct?
They're basically like flash frozen meals. They cook them fresh, lay them out, and flash freeze them. So they end up being as if they were frozen dinners, but fresh, made that week, flash frozen, and then delivered.
Gotcha.
Previously, we were just doing sandwiches for the most part because we didn't have hot meal delivery. So this is giving the opportunity to have a hot meal, whereas when the senior centers were doing it, it was pretty much sandwiches.
Yeah, that's the point I wanted to make, is that I would like to see if we can find some way to go back to some type of hot meal distribution, and understanding that it's prepackaged, it's frozen, and in preparation. But I know both the North End and South End senior centers are used to hot kitchen, hot meals, and just wanted to see what was the likelihood, not knowing how long we're going to be in this pandemic, about some way for them to start receiving. In addition, could be either or both for that matter, but some way to deliver hot meals to them.
Yeah, I think the hot meal delivery is going to always be challenging. I think we can look into it. If we're going to deliver multiple days of meals, it's going to be hard to do the hot meal. So I think that becomes a challenge. Again, we'll look into it.
We lost them again.
Happen again.
Are they both at the city? Is that what it is?
Yeah, maybe so.
They may be. They must be on the same wavelength or something.
Oh. They don't even know either, do they?
Yes, hello?
You were gone again.
Yeah.
Both times together. I don't know what's going on, but
Yeah, so Director, the question that I had was, is it possible with the hot meals? I understand that that's always going to be a challenge, but maybe on the day that we're delivering, we do one hot and multiple flash frozen. So at least they're having one hot meal. Is that feasible?
It's too long on the bus. They're spending quite a bit of time on the bus, and so from a food safety perspective, that means the meals are coming hot from CRT, then coming to us, and we have to package them because they don't come packaged. And so we don't have a way to guarantee that food will get there safely. That has been the challenge for the sandwich deliveries. We invested in coolers and things like that to keep the food cold. It's significantly harder as it relates to keeping it hot.
Okay, thank you. Councilman Gale, did you have a question?
Yes, thank you, Mr. Chair. Excuse my ignorance, but I imagine anybody that's viewing isn't going to necessarily know this. So I'm just interested to have you kind of walk us through who or what is the North Central Agency on Aging, and how do they come by all of this money? Are they an arm of the state government, the federal government, no government? If you could just kind of walk us through that.
So I'm not going to be able to answer if they're an arm of the local government, of the state government. What I will say is they are a nonprofit, and there's several in the state. So there's the North Central, the Southwest, and in the Fairfield County area. So there's several they're called area agencies on aging, and they are the agencies that receive funding from the federal government Older Americans Act. So there's money every fiscal year that the federal government puts aside through the Older Americans Act. And so there's several titles under the Older Americans Act for different services that can be provided. And so these are some of the services that can be provided that we apply for on a regular basis. There is matching required. That match is either in sort of cash, the way it is on the home help, or on staffing. So city general funds serve as our match with the staffing. But all of the state is divided into a number of areas that each has their own area agency on aging, and the funding flows from them, from the federal government to them, and then to us. So this is basically pass-through funding from the federal government.
Thank you.
So we have to apply every year. The numbers can change every year. We compete every year for this funding.
Thank you.
So I do have a question in regards to our senior centers. This may be a naive question, or something that is non-relevant, but are the senior centers able to engage via Zoom? Has there been any efforts to do Zoom? Are they doing Zoom? It'd be great to hear. Yes. So I see you shaking your head in agreement. So if you can update us,
Sure.
At least having some kind of contact.
Sure. So we've been actively engaging with the senior centers about how they're delivering their programs. And Facebook is better than Zoom because many of our seniors are connected to Facebook. They're not connected to Zoom. So we're using Facebook to live stream Tai Chi, yoga, Zumba. So we're live streaming it, and then it stays taped on the each senior center's website or the recreation website that seniors can access at any point in time after that. So that's one way we're engaging. All of the senior centers have an active outreach program to all of their seniors, checking in on them on a weekly or bi-weekly basis. So that has been fantastic, and we've been working with UConn, with the South End Senior Center. I'm gonna have discussed bringing in the North End Senior Center as well, with program through the UConn School of Social Work, reaching out to, I think it's UConn School of Social Work. I have to confirm, I believe it's UConn. that it's doing outreach to them. And so they're asking them, sort of what do they need? What kind of services are they in need of? And then they're connecting with Francis or James or Dave.
I just taken off. Oh, you guys were gone again.
Well, I stopped. I didn't say anything, so I stopped. What you heard last was what you heard last, nothing else after that. But we have been engaging them, and that's why this drive-by events are other things that we're looking at. We were able to offer COVID testing to both North End and the North End and the South End. And in terms of other services to our seniors outside of the senior centers, we've offered COVID testing at several of our senior housing facilities. So Shepherd Park, cannot remember, the other one doesn't have a name, but in Frog Hollow, we've done 2 locations. Those were door to door. Some were door to door. Some were coming down to the community room. We've done Smith Tower. We're about to do Betty Knox again. We're about to do Betty Knox for the first time. We're going to do Smith Tower again. So those are other things that we're doing as well, getting the COVID. Some of our seniors have stayed in their homes. We saw that at Smith Tower, seniors were not leaving. They did not want to come down to the community room to get tested. So we did door-to-door testing, and we offered testing to their caregivers as well. So some of them have caregivers that are there with them during the day. We offered them the testing as well because that was who was leaving the apartment. So we're trying to be innovative and using social media to provide connection and some sort of physical activity that they can do.
That's very pleased to hear that they're having some kind of connection. So just in general, were there any affects or effects in terms of, we recently at the city got, the system hacked. Was there any repercussions with our seniors in terms of any service deliverables that were impacted by that?
I don't think there was any service delivery issues with that. Those 2 senior events that we had took place after the ransomware attack, so we were able to continue with that. Where we are just operationally, we're behind on.
You gotta love it. You gotta love it. So ransomware attacks.
Yeah,
I use the word hack. Obviously, I'm showing my age, but ransomware attack. Yeah.
Yeah. So the only thing is we're behind in getting the contracts out. So you all approved the resolutions, and now we're working on getting those contracts because we didn't have access to the iDrive, but I received notification that we did today. So we're going to be able to get those contracts out within the week to our service providers so that they can get their money. That was the biggest thing for us that we faced, was just the logistics of getting contracts out to our partners.
All right, thank you. So barring any other questions, majority that have a question, am I able to combine all 3 of these resolutions with a motion, or we have to do them individually?
I would say since they have been referred as individual, we should do
individual. All right. So let's entertain a motion to approve the resolution of $60,000 a grant in funding for the city of Hartford for the Heart and Home Help Program.
So move.
Second.
All right. Second. All right. Any conversations? Any questions? Seeing none. All right. Approved.
You just ask all in favor.
All in favor? All in favor?
Aye.
Aye. Okay. All right. Is there a motion for the resolution authorizing the city to accept a grant of $31,500 in Title III funding for the Department of Health and Human Services Keep On Living program?
So moved.
Second.
Second. Any opposed? All in favor say aye.
Aye.
All right. All right. Is there a motion to approve a resolution authorizing the city to accept a grant of $65,000 for the Dollar Ride program?
So moved.
Second.
Second. All right. All in favor say aye.
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 Any opposed? All right. Passed. All right. So we passed these 3 items. Just real quickly, there is something that I wanted to just ask briefly, Director Arroyo. and that is we had our press conference on last Thursday regarding the 1.4 million in response to the COVID. And there were concerns from the community around the jobs and ensuring that the jobs came from local or at least the contracts were going to local agencies, and that some of those jobs would be folks from the people that would benefit from the jobs would be folks from Hartford. Can you just, without going into too much detail, just elaborate on that?
Sure. So we chose 3 Hartford-based organizations to receive the funding. Hartford Communities That Care. They are going to primarily focus on our African American Black community, as well as Bloomfield, because Bloomfield is one of the cities that's involved in this. It's a regional effort. That does, they'll likely have someone in East Hartford as well, but that was their focus. But they are a Hartford organization. We are also funding Family Life Education, another Hartford organization based in the Charter Oak neighborhood, if I recall correctly, Sheldon Charter Oak neighborhood. And we are funding the Hispanic Health Council, so based in Frog Hollow. So all 3 are Hartford agencies. I will say, like, with very rare exceptions, we do not partner with Hartford agencies, particularly for work like this. All 3 of these organizations were selected because they have experience doing community outreach and they have the connections to the communities that we're trying to reach. The jobs in and of themselves have been posted. They all still have openings. I will work with 311 to post them. The jobs are paying $22 an hour because they are part-time, or they are temporary jobs. We went with the living wage without benefits, since, again, because they're temporary jobs, they will not provide benefits. So we followed city ordinance in terms of following the $22 per hour wage that is required if no benefits are being paid. So that is one thing that we did, which is why we secured such a large grant, because we did the $22 per hour. We really want Hartford residents, East Hartford residents, and Bloomfield residents to apply. The idea is that is who we're looking for, because we want them to serve the community that they live in and that they know. So again, that is the primary model for a community health worker model. But people need to apply. Each of the organizations has it listed on their website, the job description. The job description is similar across the board because we worked on it together. So there's no major changes. The only thing that's required is a GED and 1 year of community outreach in whatever form that outreach has taken. But these are homegrown organizations, people that I think you all have interacted with in one way or another during your time here in the city. And the idea is that we're looking for people in our community as well to fill these positions.
Thank you. And then,
Councilman, may I also add that we still have the 5 $15,000 grants available,
right.
so that the community is aware of that. And for these, we are definitely, they're not large grants, so I don't expect the really large organizations to apply. But if there are churches that are nonprofit churches, that are incorporated as nonprofit entities, have a nonprofit certificate, or if there are smaller, our social clubs as well, Councilwoman Surgeon, I know you're involved with the social clubs. If a social club is incorporated as a nonprofit and puts together a plan, we're going to entertain any nonprofit that comes around. Again, it's a $15,000 grant for 6 months. So you're looking at about $3,000, a little less than $3,000 a month to do a series of activities that we will work with you on and provide training and materials for. It's an opportunity to get the word out for individuals. And we're going to look at our hotspots across the city. Those kind of shift here and there. But, as we get applications from organizations, we're going to look at their address. We're going to map that to our GIS mapping of where we're seeing cases as well in the city, and keep that in mind as part of our decision-making process.
Councilwoman.
And how can you get some more information on these grants?
So the $15,000 grants are posted on our website. If you go to HHS, you will see the information written out and then a PDF with additional information on how to apply.
Okay. Thank you so very much.
Yeah, so I'm sorry, I missed that. So Councilwoman Stearns, did you ask about the link to the jobs? Is that what you asked?
No, I'd asked about the small grants.
Okay,
The small grants that said it's posted on the website, and then
Okay.
each of the 3 Hartford-based organizations going to their website
And then-
to get the job applications.
got it. Okay.
So that is, no, thank you so very much. And who applied for the $1.4 million grant, if you don't mind me asking? Was that part of the COVID money?
So there were 3 grants that that my team and I wrote. One was an $849,000 grant, which is the regional grant serving East Hartford, Bloomfield, and Hartford, and that's a collaboration between us, Hispanic Health Council, Family Life, and Hartford Communities That Care. That's a 6-month grant, and that's hiring 20 community health workers,
Wow.
managers to oversee them at each location. And then very little of that money is staying with us. Less, maybe $50,000 stays with the city. It all went out the door pretty much. And then the other grant is $198,000 to do work around flu vaccine. And so that grant, we subbed the majority, pretty much all of it, with again a small portion for staffing here, to the United Way of Central and Northeastern Connecticut. We subbed that to them because they have a collaboration where they've been working on immunizations, have done outreach to our FQs, and have been working with them about putting events together and increasing access to the flu vaccination in light of COVID. So they will be the primary implementation partners, again, Hartford based. They serve the area, but they're based in the city of Hartford. And then the last grant was a grant that had been previously announced, which is the nearly $400,000 from the CDC Foundation that goes to pay, is doing media work, is paying for these 5 $15,000 grants. Is paying for initially some of our FQHCs, or at least one of our FQHCs did not have.
FQA.
Frequently asked questions.
Thank
Is that
you.
what it is?
I don't know. She
I
said
don't know. That's what I think it is.
No, I think she said FQHC, that's federally qualified
Federally qualified something.
health centers.
Health center.
Oh.
They're out again.
Yeah, they're out again.
They're just so clever.
I know, that's the way to get out of a meeting, isn't it? Did she do something about your work? Oh, they're back! Yay!
So
All right, hopefully that's the last one.
Whenever this happens, I stop talking. So I would just say the last grant was the one that was previously announced, and that's covering a whole host of things. But we are actually covered for some of our uninsured population. We covered the portion of their COVID tests that hadn't been covered. So we did some of that as well. There's some other funding in there that we're looking to support some of the in-school testing as well. We're supporting some of the mobile testing that's happening with the porta potties. So there were some things in there. We're going to cover antibodies testing, but since the antibodies is a little squishy, it doesn't last as long as we thought it did, and all of that, we're probably going to reassess that money and likely put that into, again, paying for some of the testing work that we're doing. So again, the porta potties, PPE for the school nurses, that kind of stuff.
That's what I'm saying.
Through you, Mr. Chair, you mentioned media getting information out. Have you hired a media company to assist the city? Because we don't have a lot of.
Yep.
Could you I'm sorry.
Yeah, no, that's fine. We have 2 contracts that we're currently in the process of moving on. One contract is with Maria Lino. She had worked very closely with the state on doing outreach. She is working with a Black-owned firm as well. So it's not just Latino; it's Black and Latino. They'll work together to get to do some work for us. So they're doing some formative research on vaccine acceptance and flu, and then working with us to do media buys for both of those. Yeah, so that's forthcoming. And then we will likely work with her to do some additional messaging, again, since she's already has a partner that she's working with. that covers both of our larger communities in the city. And again, they work together on the state work. So when I reached out to her, I was like, do you know of an African American or Black agency? She's like, I'm already working with someone. So sort of we were able to do both together. So there's that. And then the other thing we're doing is with a national firm who has expertise in working with social media influencers. So they've done research for us, and they've identified influencers in Hartford. So people that have a large following in the city of Hartford around a whole host of different issues. And they're vetting them for us right now to make sure they're not controversial to our messaging. And then they will work with them to develop messages around mask wearing, testing, and then work with them. I think we're looking at working with, I think it's 15 influencers, and they'll post 1 to 2 times, and then we can continue to push those posts out to our community.
If you could give us those names when you finish vetting, that'd be great.
Absolutely.
And
Absolutely.
you could also tell me who that Black media firm is, that'd be great.
Okay, I will get back to you on that. I think she gave me a name I don't recall right now, but I'll get back to you.
I know you have time. Thank you so very much.
So we got a lot of movers and shakers and influencers on this committee right here. So
Not the target population we're looking for, though. I'm not the
I think
target
I might skew
population
the age
either.
group a little bit. Yeah.
So with that being said, no other agenda items, and barring any other questions, I'll take a motion to adjourn.
So moved.
Second.
Second. All right. Well, thank you everyone for tuning in, and have a great evening.
Thank you.
Bye.